My name is Jones, and today we come with another lecture on IMCI. We are looking at integrated management of childhood illness. Okay, so we have done a lesson on IMCI PowerPoint, and we thought we can try to summarize it as much as possible for your understanding. So we have summarized more of the notes on IMCI. We have summarized the content, okay, so that we leave out some other things that might only be necessary for you to know the packages that you need within IMCI and the likes. But here we just want to talk more or streamline more on integrated management system on what should be done according to the categories or the coding. Okay, so this is the emphasis. In other lesson, we have tried looking at the package, the equipment that is needed in IMCI. But this lesson, we simply just focusing on how you manage childhood illness in IMCI. Okay, so the objective of the lesson is to reduce significantly mortality and morbidity associated with the major cause of disease in children. That is the objective of IMCI. Then the second objective is to promote improved growth and development of children. Then the third objective of IMCI is counseling of caretakers on home care, correct feeding, and giving of fluids, and when to return to the clinic or to come up for a follow-up visit. Principles of IMCI. All sick children aged 2 months up to 5 years are examined for general danger signs, and all sick young infants from birth up to 2 months are examined for very severe disease and local bacteria infection. The above signs indicate immediate referral or admission to hospital. So the principles of IMCI is that all sick children aged 2 months up to 5 years, they should be examined for danger sign. Then the second principle is that children and infants are then assessed for main symptoms. For sick children, the main symptoms are cough or difficulties in breathing, diarrhea, fever, and ear infection. So for sick young infants, a local bacterial infection, diarrhea, and jaundice should be ruled out. So the second principle of IMCI is that all infants should be assessed for main symptoms. The main symptoms that infants and young children may face include cough, difficulties in breathing, diarrhea, fever, or ear infection. So these are the main symptoms that children might come complaining of. Of course, in covering this lesson, my awareness is more to do with the geographical area from which I've drawn the principles of IMCI looking at my geographical area of location. So these are the four main symptoms, okay, that children can present with. That is having difficulties in breathing, cough, diarrhea, fever, and ear infection. So those are the four main symptoms. So the first principle of IMCI is that infants should be examined for general danger signs, and then the second one is that you need to look out for the main symptoms, or look out for main symptoms that a child can come with. So it is also important to know that all sick children are routinely assessed for nutritional, immunization, deworming status, and also for other problems. So this is very important, not necessarily part of the principle, but it is important that routinely we assess children for nutrition, immunization, deworming status, and other symptoms. Of course, that is why children and go for under 5 is for growth monitoring, okay, immunization, deworming, and also for assessment of other problems. Okay, so the other principle of IMCI is that only a limited number of clinical signs are used. Okay, then the other principle of IMCI is that a combination of individual signs leads to a child's classification within one or more symptom group rather than a diagnosis. Then the other principle is that IMCI management procedures use a limited number of essential drugs and encourage active participation of caretakers in the treatment of children. Okay, so now let us look at the basis for classifying child's illness. The child's illness is classified based on color according to triage system. Red indicates urgent hospital referral or admission. Then yellow indicates initiation of specific outpatient treatment. Then green indicates supportive home care. Okay, so these were the principles of IMCI. Okay, so then we have talked about the basis of classifying child's illness. Okay, so the color triad is like this, the basis of classifying. So green, a classification that needs education and or supportive care. Then yellow, a classification that needs a treatment at home and healthy education. Then red, a classification that needs urgent referral after first dose of appropriate antibiotic. Okay, so management of sick young infant up to 2 months. So you can assess and classify the sick child. You can ask the caretaker what the young infant's problems are and determine if it is initial or follow-up visit. Then you can check for very severe disease or local infection by asking if infant is having difficulties in feeding or infant is having any fits. You can look, listen, and feel, that is, by counting breaths in 1 minute. Repeat if more than 60 breaths per minute. Then you can also look for severe chest indrawing and also look and listen for grunting. So this can be done in the management of IMCI. So in management of IMCI, you assess, you assess and classify the sick child. Then you check for severe disease and local infection. Then you look and listen. Okay, look, listen, and feel for number of breaths, severe chest indrawing. Look and listen also for grunting. Check for very severe disease and local infection. So here you look at the young infant's movements. Infant moving only when stimulated. You look at it, infant not moving even when stimulated. So you are trying to see if the infant is lethargic or has a CNS or central nervous system involvement. You can measure auxiliary temperature. Okay, and then also look at the umbilicus for signs of infection. Okay, if it is red or draining some pus, you can always check for that. In case the child was born home and sterile equipment were used, children tend to have infection at the umbilicus, and you can suspect tetanus. Then look for skin pustules. Okay, so for very severe disease, any one of the following will help to classify it as severe disease: not feeding well, convulsing, faster breathing, severe chest indrawing, or grunting. Okay, then also movement only when stimulated or movement when stimulated. So that is a lethargic child. If the child is having a fever or having hypothermia, you can check, and it is important that you know the parameter as to what constitutes fever, what constitutes hypothermia. On treatment, you give the first dose of IM antibiotics, treat to prevent low blood sugar, and advise mother to keep child warm on the way to the hospital and refer urgently to the hospital when there is a severe infection. Then local bacterial infection signs include umbilicus, which is red or draining pus, or having skin pustules. Treatment involves giving an appropriate oral antibiotic, teaching the mother to treat local infections at home, okay, and advising the mother to give home care for the young infant. Then you can follow up in 2 days. For severe disease or local infection and likely signs, Here you look at none of the signs of a very severe disease or local bacterial infection. For treatment, you advise mother to give home care for the young infant. Then classifying all young infants, you can check for jaundice. Also, does the young infant have a diarrhea? So that is for young infants less than 30 days or 28 days. Okay, so now to do with IMCI management, to do with diarrhea. What is diarrhea in a young infant? A young infant has diarrhea if the stool have changed from usual pattern and are many and watery. That is more than fecal matter. So the normal frequency of semi-solid stools of a breastfed baby are not diarrhea. So for severe dehydration, two of the following signs should be checked out for. Movement only when stimulated or no movement even when stimulated. Sunken eyes or skin pinch which goes back very slowly. So in severe diarrhea, we can notice that there will be sunken eyes and the skin pinch which goes back with emphasis on very slowly, so it's very slowly. Okay, in trying to differentiate it with the other one. So now we move on. Treatment. If no severe disease, you give a fluid or fluid according to plan C. If infant also has a very severe disease, refer urgently to hospital with the mother, giving frequent sips of oral rehydration salt on the way, and advise the mother to continue breastfeeding, because from the breast milk, baby will be able to get the necessary nutrients and water that is needed, and you also prevent hypoglycemia. Okay, so plan when you manage, if there are no infections, when you manage very well according to plan C, the need to refer might not be there. Okay, for some dehydration signs, two of the following signs can be seen. If there is some dehydration, the child may be less stressed, sunken eyes will be there, but skin pinch goes back slowly. So in some dehydration, the issue of very is not that, but we are saying the skin pinch goes back slowly, not very, but it just goes back slowly. So sunken eyes are seen, okay, and restlessness. Okay, it's, for sunken eyes, it's also important to ask the mother if at all, if at all in their anatomical structure or appearance, there are some people that have eyes that are sunken. For some, may have naturally sunken eyes. So you need to rule out that one to ensure that it's not because of dehydration. Then for no dehydration signs, not enough signs to classify as some or severe dehydration, then you give fluids and breast milk to treat for diarrhea at home. And for this one, you are going to use plan A. So plan B will be for some dehydration, then plan A will be for no dehydration. So then you can also advise the mother when to return immediately and follow up in 2 days if not improving. Okay, so now we move on to check for the young infant for HIV infection. So you can ask, has the mother or the infant had the, okay, so you can ask if the infant or mother had HIV. We continue our lesson looking for, okay, checking the young infant for HIV infection. So to check for this, you can ask, has the mother or the infant had an HIV test? What was the result? For confirmed HIV infection signs, child has positive virological test. Treatment, you give a cotrimoxazole prophylaxis from age 4 to 6 weeks. Then you can also assess the child's feeding and counsel as necessary. Refer for staging and assessment for ART. Advise the mother on home care. Follow up in 14 days. Then for issues of signs and symptoms, one or both of the following conditions, that is mother HIV positive, child has positive HIV antibody test or seropositive. Then the treatment, you give cotrimoxazole prophylaxis from age of 4 to 6 weeks. Then you are going to assess the child's feeding and appropriate feeding advice. You're going to refer for virological tests to confirm if infants' HIV status at least 6 weeks after breastfeeding has stopped. This is to confirm if the baby has formed their own antibodies and they are positive, or the positive status was due because of the antibodies that were from the mother. So you wait until the baby has stopped breastfeeding, and then you test the child, that is 6 weeks after breastfeeding has stopped. Then you can consider presumptive severe HIV disease if at all it is found positive. Then advise the mother when to return immediately and follow up in 2 days. You can check for feeding problems or low weight for age in breastfed infants, and check for feeding problems or low weight for age in infants receiving no breast milk. You can check young infants' immunization and vitamin A status, treat the young infant and counsel the mother, and give appropriate antibiotics or like cotrimoxazole as a prophylaxis to avoid opportunistic infections and other infections. Okay, so now when to return, you can advise caretaker to return immediately if the young infant has any of these signs. Like if the infant has difficulties in feeding, becomes sicker, develops a fever, has fast breathing, vomits everything, or has convulsions. Okay, so now child's age 2 months to 5 years, you can ask about main symptoms like cough or difficulties in breathing. For cough or difficulties in breathing, the diagnosis can be severe pneumonia or very severe disease. The signs and symptoms, that is any general danger sign or chest in drawing or stridor in a calm child. So this one constitutes severe pneumonia or very severe disease. Treatment is antibiotics, IM. Then if wheezing, trial of rapid-acting bronchodilator up to 3 times and refer urgently to the hospital. Then for cough or difficulties in breathing, as the color shade yellow, that is pneumonia. Okay, so oral antibiotics for 5 days. If wheezing, give rapid-acting bronchodilator up to 3 times before classifying as pneumonia. If wheezing, give inhaled bronchodilator for about 5 days. Then recurrent wheezing, you can refer for assessment, soothe the throat, and relieve cough with a safe remedy. You can also check for HIV infection. And cough which is more than 30 days, you can refer for possible TB or asthma checkup. Then you can follow now this child for in 2 days. So this is to do with cough or difficulties in breathing classification. Then for cough or cold, as a green color coding, no signs of pneumonia or very severe disease. So this will be cough or cold. If wheezing, give an inhaled bronchodilator for 5 days. If recurrent wheezing, you can refer for an assessment, soothe the throat, and relieve cough with a safe remedy. If coughing for more than 30 days, you can refer for possible TB or asthma assessment. Then you can also advise the mother when to return immediately. So follow-up will be required in 5 days if there is no improvement. Okay, so now we move on to fever, the IMCI classification assessment classification of the disease. So fever likely causes include malaria, measles. So malaria, measles, and very severe febrile disease will be your diagnosis for red, and you can check for any danger signs like stiff neck, okay, convulsing, okay, lethargy. You can check for those. So treatment for very severe febrile disease. Okay, so here you can give a test unit for severe malaria, that is first dose, and give a first dose of an appropriate antibiotic. Then treat the child to prevent low blood sugar, and give 1 dose of paracetamol in the clinic and refer urgently. Okay, so then for malaria, as color code yellow, Signs and symptoms can be fever by history or feels hot or temperature. So this one is confirmed malaria positive. So color code will be yellow. So treatment is oral coartem or other recommended anti-malarial drugs. You can give a dose of paracetamol, okay, and the patient can go home. Treatment for very severe febrile disease, okay, that is low malaria risk. Here you can assess for any general danger sign or stiff neck. Treatment, give quinine for severe febrile disease. Okay, so you give quinine for severe malaria, that is first dose, unless no malaria risk. You can give first dose of an appropriate antibiotic and treat the child to prevent low blood sugar. So now treatment for very severe disease, that is low malaria risk, give one dose of paracetamol at the clinic, and they are also required because if it's severe may affect the brain, you can also give benzylpenicillin. So malaria, there is no runny nose present, there is no measles, no other cause of fever present, and the confirmed diagnosis is malaria by rapid testing. So treatment for malaria, you can give oral coartem and other recommended antimalarial with an antibiotic cover and also an antipyretic. So you can advise mother when to return and follow up in 2 days if fever persists. If fever present like every day for more than 7 days, then the child needs to be referred for further assessment. So then there is fever, malaria unlikely, so which can fall under color code the green. So here, runny nose present or measles present or other cause of fever present, so you check for all that. The treatment, give one dose of paracetamol in the clinic, advise mother when to return immediately and follow up in 2 days. If fever is present every day for more than 7 days, then the child needs to be referred for assessment. Now for severe complicated measles. So for severe complicated measles, signs and symptoms, that is any general danger sign, then the danger signs specific to measles that can be seen include the crowding of cornea or deep or extensive mouth sores. So if there are complications that will do with measles, that danger sign, there will be deep or extensive mouth sores and there is crowding of the cornea. Treatment is vitamin A. Okay, so then you can give antibiotic cover. If crowding of cornea or pus draining from the eye, you can apply tetracycline eye ointment and refer. Measles with eye or mouth complication. So this one falling under color code yellow. There will be pus draining from the eye, or there will be massy, there will be mouth ulcers. So for this one, treatment is vitamin A, and if pus is draining from the eye, you can treat the eye infection with tetracycline eye ointment. If the child has the mouth ulcers, you can also give treat by using gentian violet. Okay, does not have measles now or within the last 3 months and the like. So after that, then you can allow the child to go home. Then give vitamin A for treatment in treating these children. So here, this is now the classification of the diseases that we have just discussed within the color code. So we can have for pneumonia, no signs of pneumonia or every severe disease. So here, that is under signs. Then they classify as no pneumonia, that is cough or cold. Then on treatment, if coughing more than 30 days, refer for assessment, soothe the throat, and relieve the cough with a safe remedy. Okay, then if on the signs the child is having fast breathing, then the classification will be pneumonia. And then the appropriate treatment will be given an appropriate antibiotic, soothe the throat, and advise when to return immediately. Then under code red, okay, so it's any danger sign or chest indrawing or stridor in a calm child. So that is the color code, the red. Okay, so beneath there is green there, but we're saying that is color code red. So it's severe pneumonia or very severe disease. So you give first dose of an antibiotic, vitamin A, and refer urgently. Okay, so for diarrhea, okay, so we can have a 2 yellow for dysentery. If under the signs the child is passing some blood in his stool. So dysentery you can treat accordingly. And then just having a history of a loose stool, then it can just be diarrhea, okay, and you can treat, give vitamin A and other home remedies. Now, if there is dehydration present under signs, then that will be severe diarrhea. So you can give the appropriate treatment. If there is no enough signs to classify as severe dehydration, then we under green will say no dehydration, and they will give the appropriate treatment. Okay, so children can have severe persistent diarrhea if it has been there for more than 2 to 3 weeks. So that will be classified under red. Okay, so sign as dehydration. So this is the simplification of the diagram to do with the dehydration. So under signs, not enough signs to classify as some or severe dehydration. Okay, then diagnosis will be no dehydration. Okay, then what you need are the interventions that needs to be done there. Then under yellow, okay, there are two of the following. That is, the child has sunken eyes, drinks eagerly, then that is some dehydration, and then you give the appropriate treatment there and whatever is needed to be done for this child under plan B. Then for red, two of the following signs, that is normally sleepy, difficult to awaken, sunken eyes, not able to drink, okay, or drinks poorly. So this will be severe dehydration. So we are going to treat accordingly, according to plan C. Okay, so then that is how you manage. Okay, so about the other yellows, we have explained that there is a yellow for dysentery. Then there is also a yellow for no dehydration, but having persistent diarrhea. Okay. Okay, so classification for fever can have the signs of severe then hemorrhagic fever. Then it will be fever, then hemorrhagic, unlikely. Okay, that is if there are no signs of that. But if they are present of bleeding and the like, then it will be hemorrhagic fever. And then for fever, due to measles, we are looking at measles now or within 3 months, then that will be classified under green. So we say that is measles, and then give vitamin A. Then crowding of the cornea there and deep extensive, that will be classified under red. Okay, so the other classification for fever, it can fall under malaria. Okay, so this is the way to look. That is if you are classifying for malaria. So it's a blood smear or runny nose, measles, or other causes of fever not present or negative. Then it's just fever, malaria unlikely. So you can give dose of paracetamol and advise mother when to return immediately. But otherwise, if the malaria test is positive, then that will be, it's positive with no complications, then that will just be malaria. Then you give treatment with the Coartem. Then if any danger sign is noted with like stiffness, lethargic, unconscious, fitting, convulsing, that is, then that will be very severe disease, that is malaria. Okay, then fever, malaria, no signs, this we have discussed. Then under measles, this will be your triage coding. Okay, so measles now or within the last 3 months, so that is just measles, and give vitamin A to boost the immunity. Then if it is got color code yellow, that is here there will be past draining from the eyes, and there will be some mouth ulcers. So this one, it will be measles with some eye or mouthy complications. Give vitamin A, another antibiotic cover, and um, advise the mother on how to maintain good hygiene. Otherwise, if there is crowding of the cornea, deep or extensive mouth ulcers, then that will be severe complicated measles. Give vitamin A, appropriate antibiotic, okay, and we can also give tetracycline eye ointment. Okay, so then for no signs of severe dengue hemorrhagic fever, we can say fever, dengue hemorrhagic fever unlikely. Advise mother when to return immediately. So this one from green just goes to red if there is bleeding from the nose or gums or bleeding in stool, vomitus, and the like. So this will be severe dengue hemorrhagic fever. So if skin petechial or positive tonic test are the only positive signs, you can just give ORS. If any other signs are positive, give fluid rapidly as in plan C. Okay, then the classification for anemia. So that is for anemia, not very low signs here. We have not very low weight for age and no other signs of malnutrition. So it's no anemia and not very and not baby not gaining weight. So if the child is less than 2 years old, you can assess the child's feeding and counsel the mother. Then under yellow, there will be some palmar or very low weight for age. So this one we classify as anemia or very low weight. Okay, so you can manage with supplements and other appropriate drug interventions. Then if there is visible severe wasting, edema, the feet, severe palmar, then that will be severe malnutrition or severe anemia. So you can give vitamin A fair agently. Then for checking for possible bacterial infection, here they can be red umbilicus or draining pus or skin pustules. Here the classification will be local bacterial infection, give appropriate antibiotic cover. But if the child is convulsing, then for possible bacterial infections. So checking for bacterial infection under green, you can have red umbilicus or draining pus or skin pustules. Then this one classification will be local bacterial infection. Give appropriate antibiotic and advise mother to give home care. Then under red for possible bacterial infection, there can be convulsion or faster breathing. Can be severe chest and drawing, nasal flaring, grunting, pus draining from the ear. So now this one, you classify it as a serious, a possible serious bacterial infection. So you give the first dose of an appropriate antibiotic and give vitamin A. Okay, so that is how you manage a possible bacterial infection. Okay, so then you can ask, does the young infant have diarrhea? So there, the diarrhea one, okay, so we have to classify it, and then diarrhea, so the young infant there. Okay, so you can also check for feeding problem or low weight and classify as under green, no low weight for age and no other signs of inadequate feeding. So then that one to be feeding a problem, advise mother to give home care And then under yellow, you can have some, let's say, not sucking, okay, not well attached, and the like. So that will be that will be classified as a feeding problem and low birth weight. Under red, not able to feed or no attachment at all, and not sucking at all. Then this one will be not able to feed a possible CSC but bacterial infection. Okay, then you can check for feeding a problem or low weight. Okay, so this is the classification for ready, not able to feed possible CS bacterial infection. All right, so feeding problem. So it's simplification. So that is been our lesson on IMCI. IMCI management. So our lesson was focused just to look at the things that happen in the management of IMCI. Okay, so we discussed each and every condition on what should happen in the classification, okay, the treatment, and also the possible referral that is needed. So we discussed all the condition and the color coding on what should be done. So the signs, okay, the classifying the disease or the diagnosis, and then the possible treatment. So IMCI is discussed under color codes. So that's been our lesson, and I hope you have enjoyed. And from now, it will be easier to manage a child under IMCI.